Hi, my name is April Morris. I'm a family nurse practitioner with extensive experience in liver disease or hepatology, as well as endocrinology. Diabetes health, is my focus. And so today we're going to just talk about a little bit of misconceptions of liver health. And so a lot of times when patients and even some other providers that are not well-versed in hepatology or liver disease is that certain medications, oh gosh, your liver enzymes are elevated. We can't use that medication. Yes, you want to be careful. However, it's all about the pattern of trend of liver enzymes, liver function. Liver function is much more important when we look at, liver impairment. And liver enzymes tell us that something's in there causing inflammation, irritation to the liver, but doesn't mean your liver is failing. And I think that's a big misconception in reading liver labs. Labs are very important, but just to know most medications are okay, like statins, like metformin, like certain medications we use in a lot of our patients, that they are actually safe in most people and most liver conditions. But you definitely want to make sure to watch the signs of decompensating liver disease when we look at bilirubin, albumin, platelet count, those things. And so another misconception that I feel with liver health is that lifestyle modifications absolutely can make a big difference. Whether it's alcohol, intake, when you look at those people with MASLD or, we say, oh, you have fatty liver. Yes, it could be metabolic, conditions, but alcohol makes a big negative impact. So alcohol intake is very important to make sure that we counsel our patients and educate our patients on lifestyle modifications, making sure they understand that sugar is not just, the sweets and treats, but also the carbohydrates and making sure our patients know what carbohydrates are, whether it's the rice, potatoes, bread, pasta, different things, and avoiding a lot of those things. And also exercise, and 80% is diet, 20% is exercise. And liver health is so important to make sure as we take in, eat our foods, drink our drinks, whether it's alcohol or anything like that, our liver is affected by those things. And so liver health, lifestyle modifications absolutely go hand in hand. And it's very important to keep in mind that you really do hold the control and the power, as you, meaning our patients, really do hold the power and control, and our education to them to make sure their liver is at their best, at the best of it can actually function by not stressing it out with alcohol or sugar, or different things or weight, making sure weight loss is something we talk about. And so misconceptions of liver health, yes, medications can help, but lifestyle modifications always should be something that we discuss with all of our patients, and to make sure they know what you put in, what you're drinking, those make a huge difference when it comes to liver health. Yes, we want to rule out other liver conditions, but just taking care of yourself is a very important thing, and just know and educate yourself on what your liver disease is. And we help them understand what their liver condition, because it can be the silent killer, just like diabetes. If we're not careful, if I feel fine, I don't have an issue, until it becomes an issue and it's too late. So those are the misconceptions of liver health. Is education. It's a huge thing, and not to trivialize it, but also making sure that our patients just understand lifestyle modifications can go a long way, and that as practitioners that most medications are safe when it comes to liver disease, and making sure their comorbidities are better controlled to cause less stress to the liver. So again, this is April Morris, nurse practitioner. I hope y'all have a great day.